Best Teacher Award. Recent lifetime on 27th, 2025 by Nima at Nima Gynecon International Conference at Bali. Welcome, ma'am. Kindly note that
Thank you so much. Yes.
remarks from the chairperson will be shared in the video format in our WhatsApp groups, Nima OBGY group, and also our Instagram handle of Nima OBGY in upcoming days. So stay tuned for that. Welcome, ma'am. Welcome, sir.
Good
Sir,
evening to all.
request
Yes, thanks.
I request Dr. Manoj Gaikwad, sir, kindly start our today's lecture, Masanumasik Chikitsa, Scientific Study and Case Presentation.
Thank you, Dr. Chinni, for nice words of introduction. First of all, good evening to all. And I'm very much thankful to the NEMA Central OBGY, NEMA OBGY Maharashtra branch. All the executive members of NEMA Association. Today's chairperson, Dr. Neeta Maisekar Madam, coordinator, Dr. Chinni, Dr. Priyanka Madam, Dr. Rajesh Uttani sir, and Dr. Prajakta Patil. She's regularly she's contacting me and taking follow-up regarding these lectures. So I am very much thankful, Dr. Prajakta and all the dignitaries of NEMA OBGY. I am very much happy to present this topic today after so much technical difficulties. So I am very much thankful at last the technical difficulties are solved. So with this, we are starting today's topic, that is Masanumasik Chikitsa, the scientific study and case presentation. So first of all, this is the topic, or this Masanumasik Chikitsa is a specialty of Ayurveda, Prasuti Tantra, Stri Rog. And the more important thing is, this is the very peculiarity, specialty of Ayurveda. Because everyone have some desires. And that desires that is described in Ayurveda, that is Ashana. The three Ashanas are there. Praneshana, Dhaneshana and Paralokeshana. But for the woman, the fourth one is very much important, that is motherhood. Every woman desires the motherhood. But the journey of motherhood is not that much easy. Because from the day of conception till she delivers, she has to face different difficulties. And that is why the Acharya says during the Garbhini Avastha, Purnamiva Taila Patram. That means the condition which is very much difficult to carry the pregnancy and to deliver normally. Even during the delivery or during the process of uh, delivery, the one more thing that is Acharya Kashyapa says, Ekapad Yastitaha, Ekapad Yamaloke, Ekapad Yastita. That means so many difficulties she faces in every aspect of life, every stage of life. So, especially the pregnancy state is again very difficult phase for each and every woman who has to undergo for motherhood. So this is the important topic, and Masanumasik Chikitsa is a traditional Ayurveda approach to prenatal case, focusing on monthly regime to support the health and well-being of both mother and fetus during pregnancy. This holistic approach emphasizes tailored dietary recommendations, lifestyle adjustment, healthy pregnancy, and therapeutic intervention to ensure a healthy pregnancy and childbirth, and which aims to support the fetal growth and development, to maintain the maternal health and well-being, prepare the mother prepare the mother's body for childbirth, reduce pregnancy-related complications. This approach is rooted in Ayurveda principles, considering the unique needs and characteristic of each pregnant individual. By following Masanumasik Chikitsa, expectant mother can potentially experience a more balanced and healthy pregnancy. With these few words of introduction, let us start the presentation. Next, each and every person or each and every couple not only want a desired child, but they want the child having optimum levels of qualities. And that quality which defines the standards of that individual. So we know in our culture, the Rama, the god Rama, is the ideal person, and each one wants the child or the putra like Rama, child or any male or female, he or she should be have some ideal characteristic in his individuals. So the shloka is there, Varameko Guni Putro. The putra should be Guni, should be having a proper property which are in optimum level, good qualities. So everyone wants and everyone desires this kind of individual. Everyone wants these kinds of child. So they are trying for this. In Ayurveda, what is the strength of Ayurveda regarding this subject? This is the sculpture. The man asks sculpture, how do you make such beautiful idols from stone? His reply, idols are already there. I remove unwanted stones. That means in Ayurveda, everything is there, but we have to select. We have to select the proper things in proper way in the proper stage. That is the things. Because in Indian culture, in Indian environment, Ayurveda is a life science. In Ayurveda, everything is possible. The ahar, vihar, and all the things that we have to follow, everything is given in Acharya, by Acharya in the text. So we have to follow all those regimes. So Masanumasik Chikitsa is the different part, but the womanhood which starts from the preconception. Before conception, there are again the things we have to follow. So reproduction is a natural biological phenomenon. Kaumar Vritya Tantra. See, in Ashtanga Ayurveda, there is no Stri Rog Prasuti Tantra. In Kaumar Vritya Tantra, it includes Stri Rog Prasuti Tantra. Because of Apatya Dharan and Poshana Karma of Apatya or the child which holds and give birth, this is the only phenomenon which uh, creates or which occurred in the female body. That means the female in that era, they give secondary to the female. But for the healthy progeny, they describe all this condition, these stages in different way. And all these stages, they recommended different kinds of paricharya. Paricharya, that means the regime or the behavior that we have to follow each and every day, not a single day. Each and every day we have to follow all those paricharya. That is why it is called paricharya. To follow all these regularly, the uh, things by diet, by behavior, and different things we regularly do. Each one is having, and that is explained under the roof of Shreyasi Praja. Shreyasi, that means the quality child or the optimum good qualities, optimum level qualities in that particular child, and that can be achieved with the help of this Masanumasi Paricharya. For that, we see there is planning for good progeny, and it starts before the marriage. And for that, some rules and regulation that has prescribed in our text. That is, Sagotra Vivaha prohibited in our text. That the partner should not be belong to same Gotra because of fear of congenital anomalies. Partner should not have the same constitution. Same constitution may be having some difficulties in uh, different kind of stages, different kind of deformities can occur. Age, both the partners should be healthy, balanced, and constitution. The Samatavagata Viryavastha that is prescribed and the age for marriage that is also described in our text. Panchamisho tato varshe puman nari tu shodase. So 25-year of male partner and the female should be, for nowadays it is 18. So because of this healthy constitution of body of both male and female, they are more capable or they are more potent for the reproductive individuals. Who are the healthy? According to Ayurveda, healthy body, healthy mind, prasanna atmendriya manaha swastha iti abhidiyate. That is the definition of healthy or swastha vyakti. The well-balanced constitution is again a different part. And this is the peculiarity of Ayurveda. Not only body, not only mind, but in all sense, the person should be healthy. Swastha Atma Indriya Mana. Atma is again peculiarity of Ayurveda. The optimum function of all the tissues and organs. The man is the most evolved and intelligent species. He is not meant just to have children, but he aims to have children with divine qualities. Shreyasi Praja, that means each one desires the child who have a divine qualities. And for this, all those things should be there. The first and foremost thing, this start with the Garbhadan Sanskar. Garbhadan Sanskar, the Purva Karma is there. That means the purification of body, both the male and female should be purified their body with the Panchakarma. Following Sansarjan Krama and diet, they have coitus with proper position. Otherwise, different kinds of deformities can occur in the Garbha or the child that has been described in different uh, by Acharya. We know the conception and the essential part of conception, essential component of conception, that is Ritu, Kshetra, Ambu, Bija. All these four contents are essential for the conception, that is Nirmana of Garbha. Garbha Nirmiti is totally depend on all those things, that is Ritukala, the Artava, then nourishment of nutrition status of mother, and the healthy sperms and healthy ovum. Not only all these four things are four components which are essential for Garbha Nirmiti, but the Shadabhav is also responsible for different indriyas, the different organs, and that Shadabhavas, when these Shadabhavas are normal, so the person, the child is totally normal. And what are those? Matruja Bhav, Pitruja Bhav, Rasaja Bhav, Satmeja Bhav, Atmaja Bhav, and Sattvaja Bhav. All these Shadabhavas are very much essential to normalize that individual or the Garbha having those divine qualities. They should have all these Shadabhavas in normal way. We found that there are some congenital anomalies or Sahaja Vikruti, maybe anatomical, maybe physiological, and all those Vikrutis are found due to prakop of dosha. And this dosha prakop, all three doshas get vitiated by different things. We know the loka, that is, what are the different things which creates congenital anomalies or which are responsible for congenital anomalies. and that is Bija dosh, Atma dosh, Bijatma karmashay, Kal doshaihi, Matustata ahar vihar doshaihi, Kurvanti dosha vividhani, Dushtaha, Sansthana varna indriya vaikrutani cha. Bija dosh, Atma dosh, Karma dosh, Ashaya dosh, Kala dosh, Matu ahar vihar doshaihi, in which anomalies can occur, Sansthan, whole system can be affected, Varna, that is the consistency, the Swarup can be affected, and the Indriya, maybe Karmendriya, maybe Jnanendriya, that can be affected. And all those factors, that is Bija dosh, Atma dosh, Karma dosh, Ashay dosh, Kala dosh, and the diet of and behavioral or lifestyle of mother, which is responsible for karma, Sahaja Vikruti or congenital anomalies. So, not only in these conditions, but antenatal, intranatal, and postnatal, different conditions can be affected the person or the child. That is, during pregnancy, any infection can occur, especially urinary tract infection. And when there is a chronic urinary tract infection, that leads to IUGR. So we have to treat each and every person who is having urinary tract infection. The mother should be treated properly. If you found pus cells, whether it is 8 to 10, sometimes we neglect, but any pus cells we have to treat properly, whether it is in less number or more. So we have to treat accordingly, otherwise it affects the fetus. Fever, URTI, rubella infection, all these conditions that can affect the child or the fetus. Intranatal, during labor, excessive straining, and uh, the straining uh, without dilatation of cervix, that again leads to different kind of deformities in that particular fetus. Prolonged labor, hydrocephalus, cephalohematoma, all these conditions can occur during intranatal period. Postnatal, that means after delivery, improper care of neonate, infection, septicemia, kaphadushta stanya, and sometimes we found different deformities or different sign and symptoms, but we don't find any cause. So there are some conditions which are under unexplained causes. We know the definition of Garma, that is Shukra Shonita Jiva Sanyog, Kalukukshigate Garba iti Saudya. Again, the peculiarity or speciality of Ayurveda is there. Not only Garbha and Shukra and Artava, the union of Shukra and Artava, but Atma is again very important part. In ART technique, we know different kinds of treatment modalities are available now, but still the failure rate is again very high because Ayurveda is different. Ayurveda uh, more focused on the Atma Pravesh. Not only the union of sperms and ovum is the conception takes place, but the Atma Pravesh, and that is why when there is a ART technique but no Atma Pravesh, the failure rate is more. This is the Masanumasik Garbhavriddhi. The first trimester, second trimester, and third trimester. The different uh, growth and development in the fetus is there. So today's topic is our Masanumasik Chikitsa. So we skip these slides for a while. But for the growth and development, each and every step is important. So we divided the trimester, first trimester, second trimester, and third trimester. And for this, uh, when we're talking about the Garbha Vakya or Garbha definition of Garbha, Shukra Shonita Jiva Sanyog, again, the three doshas are again responsible for different kind of functions. Garbha Grahan, which is a function of Vata, Pitta, there is a parivartan or transformation in different kinds of process in the garbha or in the process of in the body of mother, transformation, different kinds of level. So all these functions are occurred due to pitta, and the kapha, which is responsible for sthiti, upachaya, and bruhan. And again, Panchamahabhuta, the role of Panchamahabhuta is there. That means Prithvi gives strength to the fetus. Apaha, that is, which is responsible for mixing or ekatrikaran. Up Teja, that means transformation or Rupantar. Vayu, which is responsible for Dhatu Vahana. And Akash, which formation of Srotasa is. That is why the each and every uh, fetus is from the Panchamahabhuta, or each and everything, just like Srishti, Pindite Brahmandi, everything is because of Panchamahabhuta or made up of Panchamahabhuta. According to Ayurveda, in 9 months, there is a growth and development which is described in Ayurveda. The Prathama Mase Kalalam Jayate, Dvitiya Ghana Sampadate, it becomes solid and it takes some kind of shape, and that means Ghana Purush, Peshi Stri, and Arbuda Napunsaka. This is the peculiarity of Ayurveda. Tritiya Mase Panchapindaka Nirvantante. चतुर्थे सर्वांग प्रत्यांग विभाग प्रव्यक्तो भवति, especially हृदय प्रव्यक्त भवति, and दौर्द can occur. स्थिरत्वम आपद्यते गर्भा in 4th month. पंचम मास मनम प्रतिबुद्धतरम भवति. मांस शोणित उपचय is again occur. पंचम मास. षष्ठी बुद्धि. This is a development of buddhi in Shashtam Mas. Saptam Mas, Sarvanga Pratyanga Vibhaga Pravyaktatara Bhavati. Ashtama Mas, Astiri Bhavati Ojaha. And the baby can deliver after the completion of 9 months. After completion of 9 months, the Prasavakal is there, and baby, delivery can take place at any time. This is the different opinions regarding different acharya that I have mentioned here. Different part develop in different month that is given in Acharya. This is the month-wise development by modern science. I don't want to explain it because it is given in books, and today's topic is not our Garbha Vriddhi. We are talking about the Masanumasik Chikitsa. So these are monthly development. I skip all those things because of the time is less. So Masanumasik Garbhini Paricharya, that is prenatal care. We know Purnamiva Taila Patram. The condition of Garbhini is very delicate. Any type of any trauma that leads to the diseases which are very different or which are very which can occur serious regarding Garbhini Avastha. Garbhadhan Sanskar already we have talked about. Then with the help, with the desire of parents, the couple, whoever wants male or female child or desire sex, he or she should keep in mind and heart the same appearance, character, country, and Janapada. If possible, should visit those places, observe and try to adopt those food and living styles, dresses. So whatever they desire, they can achieve with the help of these kinds of behavior. Ayurveda has described a systemic and planned program for Garbhini, and that is Garbhini Paricharya. Ahar, Vihar, and Vichar, all these are conditions. In Indutika, Ashtanga Sangra, Indutika, the aim of this Garbhini Paricharya, which is described, that is Anupaghata. Anupaghata, that means to provide optimum protection to fetus and mothers so as to reduce maternal and neonatal morbidity and mortality. Not to happen anything which is not desired. That means it should be safely uh, developed till delivery, or to, he should complete paripurnatvaya. That means he should complete the tenure of 9 months. That means 280 days without any complications. Paripurnatvaya is the second aim to ensure continued medical surveillance, prophylaxis, and for complete somatic and neural development of the fetus. And the third one, that is Sukha Prasavaya, to prevent or to detect and treat complications, if any, and achieve normal delivery at term. Nowadays, we know the rate of cesarean section is very high. The causes are different, the etiological factors are different. Today's era, the different conditions are there, but still patient wants Sukha Prasava, that is normal delivery, and that can be achieved with the help of uh, following Ayurveda, following Garbhini Paricharya. The antenatal care, that is systemic supervision of a woman during pregnancy, aim to screen the high-risk cases to prevent or treat or detect at any earliest complications, to educate the mother about the physiology of pregnancy and labor, to discuss with couple about the place, time, mode of delivery, provisionally, and care of newborn. So all these things are uh, incorporated or included in antenatal care. The objectives are to ensure normal pregnancy with delivery of a healthy baby, healthy mother. The goal of antenatal care: ensure mater and fetal well-being, identify high-risk pregnancies, prevent and manage complications, health promotion and counseling. According to WHO model 2016, the first trimester, the patient should visit. The different visit is uh, directed by the WHO. That is first visit in the 8 to 12 weeks, second visit in the second trimester, visit 2, third trimester, visit 3 and 4, and in first trimester, visit monthly, second trimester, 2 week, and in the last trimester, weekly visit should be advised. Procedure in first visit and subsequent visits. In the first visit, we have to take proper history, thorough examination, and advise proper investigations. So history includes particular of that patient, chief complaints with duration if she is having, past history if she is having any systemic diseases or any peculiar history related to obstetric history, that means previous birth and birth history regarding cesarean section, instrumental delivery or vaginal delivery, or any history of abortions, IUD, menstrual history, whether she is regulating normally, menstruating regularly, family history, is there any history of in the family, that means twins or any related to ops, personal history, whether she is having any systemic diseases, socio-economic history, and by this history, we have to go for thorough examination, general examination, inspection of abdomen, that we have to find out the different position of the fetus. That means 5 things we have to observe. That means Garbhashay Unchi, that is fundal height, Garbhasiti, that is fetal position, Garbhashira, that is fetal head, whether the presenting part is cephalic or not, Garbha Rutspanda, that is fetal heart sound, and fetal movements. All these things we have to observe keenly. Again, we have to find out whether any surgical scar. Palpation, fundal pore determination, all those griefs be in different months from first to ninth month, different kinds of regime which is given to the mother. as a diet. In the first month, Madhura Shitadrava Ahar by Sushruta. In the first 3 months, according to Sushruta, Madhura Shitadrava Ahar. In the fourth months, milk, butter, and meat should be there. In Panchama, Kshir and Sarpi. Shashtama, Shvadanstra Siddha Sarpi. That is very much important part of this Masanumasik Patya. That is Shvadanstra, that is Gokshur, which is responsible for uh, Shotagna, having property of Shotagna. And in usually we see after completion of 5 weeks or in the 20 weeks, sometimes there is pregnancy induced hypertension. So tackle all these problems. The Shvadanstra Siddha or Gokshur Siddha Gruta is useful in that condition. Saptama, Pruthak Parani Siddha Gruta, Ashtama, Badarodak Kvat Basti is advised. According to Charaka, again, in the first month, Shitala Dugdha, that means cold milk is advised. Madhura Aushad Siddha milk is there. That means in the first 3 months, all acharyas usually used milk and milk products. So for the nourishment of fetus and mother, the milk is the whole meal for both of them. So milk is very much important for first trimester. In and Madhura Aushad Siddha Dudh, which is again very much important factor, it's which is having property of Balle and Bruhan, which is very much useful or beneficial for the fetus and mother. For in the second trimester, usually meat and meat products and some milk and milk products also there, because in the second trimester, mounts and shoni to upachaya bhavati, and again requirement of protein is there. So for the requirement of protein, they advise mounts, that is meat. In the third trimester, sometimes patient may suffer from constipation. Vata prakop may be there. So for the Vatanuloman, Basti is advised. And again for the Apanvayu Anuloman, the Basti is advised. In the Ashtam month, Basti is more beneficial. And in the 9 month, Yonipichu to smoothen the pelvic organ, the vagina, the introitus, which is helpful for easy delivery. One patient, one of my PG student, I have given a topic that is um, for smoothing or for the normal delivery. Uh, the drug, I forgot but she prepared gel, potikimul. That potikimul, she prepared gel and she applied after the uh, onset of labor. And just like we use Serviprime gel, she used to apply that potikimul gel, and she observed near about 120 patients she took, and she observed the progress of labor with the help of this Pratak Parnadi uh, potikimul gel. So we found that the process of labor which starts and the time required for the total delivery that reduces, but there is no role of that potikimul gel on cervical dilatation. But the after dilatation, full dilatation of cervix, the baby of delivery of the baby is very much easy with the help of this gel. So this kind of studies should be there. More study is required. So in the Navam month, Pichu is very much important for the smoothening or soothing of pelvic part. Uh, Sometimes we found that many patients are they are having a recurrent pregnancy loss, or the pregnancy which is conserved, but sometimes they get malpresentation may be occur, and for that sometimes premature labor, sometimes get aborted. So for this or bad obstetric history, we usually do the medicated ghee, and patient uh, we advise them to take this medicated ghee throughout the pregnancy. And that Prajastapak Dravya are Aindri, Brahmi, Shatavirya, Sahasravirya, Amogha, Avyatha, Shiva. All these are the Prajastapan Gan, which is very much useful for this kind of patients to prevent recurrent pregnancy loss, which gives strength to the uterus. And sometimes, whenever there is an iodation problem, so these kind of patients get benefited with the help of Prajastapak Grita. In Sushruta, Garbhasrav, that means the bleeding, occurs in any month during pregnancy. The treatment or the medicine or the drugs or the combination of such kind of drugs which is advised by Sushruta from first month to uh, 10th month. All these drugs, all those combination of drugs that can be tested. This is the again a research topic to give our PG, PhD students for the each month and to develop data. This is again an important task, and we should think about this. Maybe in each and every month, these kind of drugs are helpful in that particular month per vaginal bleeding. Nowadays, the month wise tablets in the tablet form uh, are easily available in the market. But according to me, if you give this kind of medicine, that means in the form of freshly prepared quath, that are more useful or fruitful to that particular patient. Different medications are useful in pregnancy. That is monthly regime. First 3 months we have already talked about 100 ml milk medicated with Shatavari or Bala, Drakshadi Leha, Ushmanda Rasayan, Falagruta, Shatavari, Siddha uh, or Jivaniya Bruhaniya Madhur Aushadhi Siddha Gruta, 5 ml twice a day or 10 ml once in a day can be given with the meal till 3 months. 4 months, we have to give Falagruta, Dadimadi Gruta, Shatavari Siddha Gruta, Shatavari or Yashtimadu Siddha Gruta, Vidari Siddha Gruta or Vidari Churna can be given. Kushmanda Rasayan, Drakshadi Leha, Shatavari Rasayan, 10 milligram or 10 gram uh, twice a day with the help of with the milk. Punanava Mandur, Dhatri Loha, Shatavari Mandur, Mandura Vatak, Swarnamakshik Bhasma. These all medicines are required for the requirement of Loha or requirement of iron, which is useful. And it is very useful in those patients who are having gastric upsets or not absorb the iron tablet. And we can give these kind of drug, and they are very easily absorbable without any side effect, and that can be given in long term basis. Pravar Pishti, Kukutandatvak Bhasma, Mukta Shukti Pishti, all these are can be given as a natural calcium. In the 5th month, Punarnava Mandur, Dhatri Loha, Shatavari Mandur, Mandur Vatak, Swarnamakshik Bhasma, Kasisa Bhasma, all these are very much useful in case of iron and calcium requirement. Pravar Pishti, Kukutandatvak Bhasma, Mukta Shukti, as in the 5th month, Maunsa Shoni Tupachaya Bhauti. So all these drugs are uh, fulfillment requirement of those dhatus. So Abhyanga, Mrudu Abhyanga is very much useful in this kind of in this month, because as the Mounts and Shoni Tupachaya is there. And again, one thing is mentioned in Ayurveda, that is Karsham Apadyate Garbhidi. That Karsha, for that Karsha, it is very useful uh, Abhyanga with the uh, One more, my PG student, I have given a topic that is Garbha Vilasa Tail for Mrudu Abhyanga, and that was very useful. He had taken more than 100 patients, control group and trial group. In trial group, he has given 50 patients Garbha Vilas Tail for the Mrudu Abhyanga, and that was very useful for the Bruhana. And when there is some kind of irritability of uterus or irritable uterus, we found sometimes patient is having irritability. So in that cases, again, Mrudu Abhyanga of Garbha Vilas Tail is very much useful. We have treated so many patients with the help of Garbha Vilas Tail. In the 6 months, again, Dadimadi Gruta, Shatavari, Kushmanda, Punarnava, all these Bruhan and Balya, and having Loha in that drug, which is useful for the requirement of Loha. Again, Yavagupan, medicated Gokshurugruta, is again very much useful in the 6 month. Due to fear of Shota, we have to give Gokshura. And one more thing is regarding Gokshura. That means sometimes we give diuretic to the patient in modern science, but diuretic drugs may give rise to potassium deficiency. But in Gokshura, there is no potassium loss and patient can be take it easily for the long term. Shankapushpi, again, some kind of patients having more depression or anxiety, so they can take this kind of drug. Abhyanga with Mrudu Abhyanga tail, which is very much useful in 6 months. 7 month, again, Dadimati Gruta, Balamul Siddha Gruta, Sukumar Gruta,